And of course, along with that, there are other diagnostic procedures as well, like the biomedical pulse, which is based on a plethysmography, and so on and so forth. You know, there's different skin testing devices. You can have hair testing devices. You know, you look for the density. You know, because when you talk about wellness, the desires and the expectations of people, they concern everything. They concern how their face gonna glow and shine. They concern their hair. They
how their body looks, body fat, whether it's toned.
Yes, and not only looks, how you feel.
Yeah, you don't feel always tired, hunched, letharged. Perpetual migraines, stiffness.
Yes,
all of that.
You want the clarity of mind.
Yeah.
You want good memory. You want the ability to fall asleep fast, wake up being absolutely refreshed, recharged, and have an active day. You want to be able to, if your pen falls down, you just bend down and pick it up without holding something else, without holding the chair, or without holding your lumbar, your back, like, oh my God, trying to squat. That's unnecessary. Yeah. That is unnecessary. And if you ask me, is it achievable? Absolutely yes.
Regardless of which age they might be in?
Regardless of what age. It's regardless of what age. It's two things. It's possible to preserve and maintain it, but if something happened, and you lost it, it is possible to regain it. Maybe not 100%, maybe not in 100% of cases. Okay, maybe not in 100% of cases to 100% extent, but very, very much possible. And time is another factor for that. Okay, quick fix usually might end up with a quick sort of throwback to the condition again. Yeah, it's very important that the achievements which are achieved are sustainable.
And I think it's also sustainable when it actually tackles the root cause of it, right?
Absolutely right.
Rather than just a very symptomatic approach to it.
Another difference is, instead of treating the symptom, it's always going to the core of the condition, the actual reason why that has developed. And unless you change the reason, cardinal changes to that,
it keeps coming back.
So
like, you come in for this surgery, for example, or you come in for this treatment in, let's say a hospital, and then you go back out, and maybe you relapse, right? Like, it comes back maybe after another 6 months, another 1 year. Especially, I notice this is very common for those who are, in need of pain management. Because of, again, I would call it the urban disease, because of, a lot of us sedentary lifestyle, always in the office, 8, 9 hours, 12 hours non-stop at our desk, typing, eyes just focus on one thing, you don't really move, then you get tennis elbow, you get carpal tunnel syndrome, all of these things. So it's more of the pain that, people have to deal with, and it's always on painkillers and, all of these things, which I think it's really not healthy. So
Right. And here is here is the importance of the science, and is a bit of touch of a translational medicine here. What I mean exactly is that our understanding is changing and improving all the time. And about a decade ago, the so-called the 7 pillars, they call it the 7 pillars, or the 7 drivers of aging, were more or less defined, and a chronic, long-term, persistent systemic inflammation, which is not the inflammation in the common understanding. It's not the acute inflammation. It's a low-grade chronic systemic inflammation.
It's there.
It's 100% component. It's present in 100% of aging cases, put it this way. So whatever age-related condition, whether it's atherosclerosis, osteoarthritis, chronic inflammation, neurodegenerative diseases, is always present. And other biological phenomena like loss of ability to detoxify itself, but the cells, the tissue lose the ability to detoxify itself.
So it just retains the toxin in there and then...
Well, it's not really, it's toxin, yeah, but it's more like the metabolites, the products of the metabolism. They are accumulated in the cell in specific compartments. That is counterproductive, counter-efficient for the function of the cell and the tissue. The ability to eliminate those byproducts of the metabolism, it's called proteostasis. Yeah, it's also one of the components of aging. That's why autophagy is actually one of the ways to counteract that, to target that specifically. We talked about that. It's very, very important. Now it has been recognized. Japanese scientists, they've recognized that autophagy, or rather a loss of autophagy, is one of the main predictive factors explaining or defining who's going to deteriorate and who's not among the people with cardiomyopathy. So to a large extent, if there is a loss of the autophagy in the heart cells, to a large extent, that will be a predictor to a more unfavorable course of the disease and higher risks and perhaps deterioration and faster rate of deterioration and lesser lifespan.
Yeah, understood.
Okay? And of course the stem cell exhaustion. Yeah, so there's a pool of the stem cells, and different tissues have the ability to regenerate to a different extent.
And it's finite, right? Like I think the ratio is what, 1 to 10,000 or something like that?
No, there's it depends on the tissue, it depends on the organ, it depends on the age of the person. There is no blanket rule for that. There are some organs that practically don't regenerate, or the regenerative capacity is very, very, very minimal, like the heart. The cardiac myocytes, the turnover of the cells is about 0.4% per year.
Wow, compared to maybe liver, for example.
Compared to liver or skin, the organs which can regenerate much faster. Some organs have practically zero capacity to regenerate in a long term, like kidney. Kidney has the mechanism to repair itself from the acute kidney injury. With that temporary recruitment of the mesenchymal stromal stem cells, the MSCs, they are capable of sort of repairing the damage or the damaged pool of cells, those endothelial cells and the podocytes and all, in the kidney after the acute injury. But if the acute injury is repeated, that mechanism doesn't work anymore. And if the injury has a chronic sort of nature, so then there's no
like CKD
potential, right? There's no potential to regenerate itself.
So you have to do it externally.
So yes, you have to do it externally. And that's where the translational medicine and the regenerative medicine, or the science of the bioregeneration, let's move away from the word medicine. It's more like a science of the bioregeneration comes in place.
As a solution, right, to those which
as one of the possible solutions for the untreatable chronic diseases. And if the nature of the disease in every particular case is well understood, because there are nuances, there are differences in every particular case. Why? What was the background? What was the cause of that CKD? If it's an autoimmune condition, or it's because of the diabetes, or it's because of the due to the hypertension, or it's due to the substance, the different treatment, adverse reactions of medications or any substances and so on, it's gonna be different, So if you can analyze the case and find those differences and try to apply different sort of treatment methodologies, perhaps you can have a chance of, if not full recovery, at least to slow down the progression.
Yeah, at least you
That is also very
extend it so you don't feel...
Right,
Yeah.
right. That is also, it's a great thing, you know. And then, of course, after that, who said that ultrasonography is not supposed to be used? On the contrary, the wellness practitioners, you know, they should be able to at least read and understand the report of which is done by the radiologist, if they're not capable of doing the examination by themselves, which would be a great thing, of course, to do.
Okay.
You know, and other diagnostic procedures which are actually used in conventional medicine. If there is a need, they should and they are used in the wellness medicine and anti-aging medicine as well. You know, so after that understanding sort of is obtained and you have the picture, then of course you can design the therapeutic paradigm easier,
which is
right?
very customized, you know, as opposed
It has to be customized.
generic.
It will not be absolutely blind shooting blanks in the wrong direction.
Everyone walks in, you get this treatment. You know, some people may not need it. You see, so I think that's also what people are looking for, because in a time and era now where everyone wants things personalized, you know, personalized keychains, customized number plates. You know, we also want our treatments, just like our workout regimes, to be also customized based on our specific needs. You see, in this case, I think you brought up a very good point that the diagnosis is actually very key, because a lot of times people go for a lot of treatments, but they don't really know what is the problem. So, you know, they end up spending a lot of money, you know, on really random things, and they don't get the results. So they get frustrated, they start to give up on themselves, they start to give up on, you know, the practice that was supposed to help them, you know, find comfort and to, you know, and recover.
Because when something is very generic, when the approach towards management of health span and lifespan is very generic, well, highly unlikely that it will bring 100% satisfaction in the individual. Okay, and when you have the holistic approach towards the diagnosis, of course you have the holistic approach towards management, right? And a personalized management is a type of management when you do not force a person into some frame, you know, into some box.
That's what you need, you know.
That's what you need. You know, you. This is your diet.
Yeah.
Because we have printed it out on the paper. Oh,
Follow
what's your diagnosis? Your diagnosis is that, so we take this diet. Now this is your diet.
Yeah.
You do this, and this is gonna be your exercise. And here is a set of medications. Go to the pharmacy, get it, and take it. Right? See you in 1 month, or 3 months, or 4 months. Sometimes you don't even have to see the practitioner, just come get the same medications, go back and
it's like a lifelong kind of...
Lifelong,
Oh.
absolutely.
You become so dependent on those things.
Nobody will become, well, it's not even about that, but nobody will become happy.
Of course not, because you're forced to do
You're
that.
forced to do that. You're forced to do that. That's why I believe that every journey has to be a joy.
Yes,
Right? It has to be. You have to love what you do.
and understand why you're doing it. I think.
Oh yeah, absolutely,
when
absolutely.
You know, it's like, for example, you know, oh, you're pre-diabetic. You know, you need to cut down your sugar. Okay, I know, because there is that thing. Or you know, you're prone to, you know, you're a very excitable person, you know, and that's going to probably affect your heart. So you need to know how to, you know, manage that as well. So people know, okay, you know, I need to avoid this food. I need to avoid this activity. You know, so that my health is maintained. You know, so I think that's sometimes also lacking that. You know, again, because everyone sees, in a way, patients like on like a factory, you know, like a supply, like a belt, you know, a manufacturing belt. So everyone's just on it, and you're just given that same dish. Like, you know, it's terrible. You think that everyone's just mass produced.
It's terrible, and in maybe 99 out of 100, it will not make the recipient happy.
And they will not continue with it, which would mean that, you know, they probably do it for the first couple of months. you know, and when it starts becoming such a chore and a burden and you don't see the logic in it, a lot of them just give up on it, and that's when the thing relapses.
The more uncomfortable, the less joy a person has while being on their journey. Of course, the more chances that they will just drop off
the program. Yeah.
Okay, so here is why the generic approach doesn't work. When you, in details, find out what the person is doing and what the person likes and the preferences and all, then you create, or we create a program specifically for that person with taking into consideration their preferences, their likes and dislikes, but in the same time taking into consideration the results of the tests, like the food intolerance test or the food allergy test. That is also done routinely, or at least should be done routinely in every particular case. You know, you need to know what weakens you. Yeah, because different types of food, they do not suit.
Or what might you be allergic to, for example? Like
allergic, that's in the worst case scenario, but we try to dig even deeper. You know, see food intolerance. Intolerance means something that weakens you, either weakens your immune system or weakens your digestive system. Okay, and from there you try to adjust that, optimize it. Okay, there are always two directions. By eliminating things that make you weak, slowly, one by one, and by bringing in and trying the components which will make a person better and stronger. Okay, so there is definitely no, all right, this is the paper, just follow this particular diet. No, it's always one variable at a time. Okay, it's always start with something very, very important and bring the person through a transition. You know, it should not be the abrupt change. It should be the transition. The person should be comfortable, and yes, of course, the person should be in absolute understanding
of why they're doing
why they're doing that. That's why, you know, I so love to explain to clients, patients, and everyone I'm talking to, and sometimes I might explain that a bit too sciencey. But I think it's totally fine, because it would be wrong to think that something is just beyond understanding, or it's too scientific or something. Nah, nothing
and
like
if
that.
the patient, I think, really wants to know about their situation or their condition,
People read up on the Google, Internet, everything.
Yeah, they would. I think they probably come even prepared for the session. You know? So they're like, actually, doctor, you know, I've seen this. What do you think? How does this affect me? Or should I try this treatment? You know, I mean, it's very new. What do you think about it? So and I think it's great, because now we're in an era where it's the K economy, right? The knowledge economy. You know, everyone has a smartphone. Everyone is in the know. In fact, we have an information overload compared to 20 years ago, before the internet was invented. You know, so I think even the way that people perceive their wellness, or the way their relationships and their interactions with their wellness coaches and practitioners have also evolved as well. You know, and I think it's also important, I think, even for practitioners to also keep themselves up to date.
Oh yeah, absolutely. You see, the saddest situation is when a client is more informed or more educated than a service provider.
Yeah, that would be very scary.